Good morning, Wise Tribe. I hope you're well today. We're here with Dr. Sue-Ann Ho of Dermatology and Surgery Clinic, and we're talking about skin cancer. What are the warning signs? Ooh, hold on for 1 second, there's something just there. Just want to double check. Okay, I think everything's okay. What are the warning signs and what can we do to help detect skin cancer? So thank you for joining me today, Dr. Sue-Ann.
Thank you for having me.
Now, skin cancer is one of the top 10 cancers diagnosed in Singapore, so it's obviously a really serious concern. And as expats, it might be something that we're not really used to thinking about and addressing if we've been here for a short space of time. Perhaps we forget to include it in our regular healthcare checkups. So I just want to get a kind of overview of what we should be doing on a regular basis and how to look out for any abnormalities that we should really get checked out. So can I ask you first of all about checking at home? How often should we be checking our skin and what should we be looking for?
Generally, I think there are no specific guidelines, but most people would say check regularly. For me, I tend to advise my patients to check it once a month. Because if you look at it daily, you get really stressed out staring at one mole. Yeah, and see how it changes.
It's like a spot the difference puzzle, isn't
Correct.
it?
You get a bit frustrated. So
Right.
sometimes a picture at the beginning, and then at a monthly basis, just have a look-see. If something does look a bit suspicious, then that's probably when you should go and see your dermatologist.
Okay. Are there any specific areas or just generally all over?
So the way you should do a skin check would probably be using a full length mirror, standing in front of there, have a look at your face, look at the front of your body.
Yes.
Don't forget the side. So you turn, lift one arm up, lift the other arm up. Okay, and for the arms, have a look at them. Don't forget between the finger webs, between the fingers.
Right.
An area that I myself don't really see that often is here. So for example, when I do this, then I realize there's a mole here.
Yes.
So there's another hidden area, the side of the forearm.
Yes.
Don't forget the legs. Sit down, you can lift your leg, check the bottom of your feet in between your toes. And finally, use a mirror for the scalp and the back of the head, which can be a bit challenging, but the other one is to get your partner to have a look for you.
Right, so it does take a little bit of effort. It is something that you consciously need to sort of check in and say, okay, today's my monthly skin check, I'm going to get the mirror out, I'm going to spend 5 minutes
Exactly.
checking everything out. Yes, it's a good reminder. I myself don't do it regularly, I have to say. When we are checking overall, what should we be looking out for? Is it the number of moles? Is it the size of the moles? Can you tell me just a little bit about what are the warning signs that we're looking for here?
So I think the commonest skin cancers that we're talking about would be the non-melanoma, which consists mainly of the basal cell carcinoma and the squamous cell carcinoma, and the other one would be melanoma. So these are probably the top three. Skin cancers can come in various forms, but a few signs and things that you look out for would be sometimes a dome-shaped nodule.
Right.
Lesion that repeatedly breaks down, crusts, bleeds, ulcerate meaning we have broken skin on the top. For moles, it could come in the form of well, if we look up the A, B, C, D, E of mole monitoring, that gives us a rough, for people who like mnemonics, it gives us a rough guide on how we can monitor.
Okay.
So for A, it's asymmetrical. So most moles tend to be round or circular. If you bisect it in half, you divide it in half. This half sort of looks like that half, but if you see your mole growing an arm and a limb on one side,
right,
that's probably something to take note of. B stands for borders. So most moles you can actually take a pen and trace around it quite well, quite confidently. If the borders start becoming a bit fuzzy or it starts becoming irregular, starting to look like a map of some.
Right, so it's kind of bleeding out a little
Correct.
bit.
Yeah. Sometimes I tell my patient it may look like flower petals or somebody took a bite of the edge.
Right.
So an irregular border. C stands for color. So most moles again tend to be one tone. So if you notice over time it becomes intensely dark. That's one. The other one is a mixture of colors in a very haphazard manner. sometimes one part may be darker, one part may be lighter. You might even see a hint of red or white or various colors there.
Right.
That's something to get checked out as well.
Mhm.
Moles that are greater than 6 millimeters sometimes make us a little bit jumpy, but more importantly, it's evolution.
Mhm.
So meaning how it changes. So E stands for evolution.
Mhm.
We talked about how it changed in terms of shape, size, color.
Mhm.
There's also change in terms of, I usually include this as a basket to catch everything else, symptoms. So if something starts to be painful or itchy, you might want to get it checked out.
Right.
If it's bleeding for no apparent reason. So a common example that I would tell my patients is saying that you have a mole here. It's an area where it's prone to trauma. You hit the table.
Yes.
Yeah. It bled. Okay, it healed, but it broke down again for no apparent reason. Get
Right.
that checked out.
Okay.
Yeah.
So that's important to monitor it as well over time. Yeah.
That's probably important to get it seen by a dermatologist
Yes.
soon.
Yes. Okay.
Yeah.
So let's say in that example, you've seen something that you think needs to be checked out, and you can book in to come and see a dermatologist here. What would happen in the consultation? How do you assess?
So most patients come over for a mole check,
Mhm.
or like you say, if there's something that's worrying them.
Mhm.
We do a full body screen from head to toe. You see us bring various lights and little magnifying glasses to have a look.
Okay.
We'll identify those that we think are suspicious,
Mhm.
and then unfortunately, the only way sometimes we can be absolutely sure is to do a biopsy.
Right.
So we may arrange for a biopsy for you,
Mhm.
for the patient to get it checked out.
Mhm.
Yeah.
So how long and how intense is that process? I know a lot of people might be a little bit concerned about, somebody coming up to them with a magnifying glass to check out each and every inch of their body. How kind of invasive is that
So
check?
we do it in a private consult room, something like this, just
Mhm.
patient and myself.
Right.
And I'll talk them through it, walk them through it, what we're gonna do, what you might expect will happen. Sometimes some patients are a little bit uncomfortable exposing certain parts, but most patients are actually quite okay with it. Yeah. If they are comfortable, they are letting me examine that area.
Right. And do you have, presumably you have male dermatologists here as well?
Yes, we
Male
do.
doctors for if somebody's more comfortable coming to see a male doctor.
That's right.
So they can pick and choose who they're more comfortable with. Yeah, I think that's important. It's very personal.
Absolutely.
So if something abnormal is picked up, you mentioned you may well do a biopsy. What happens next? What's the process?
So we arrange for a biopsy to be done. It's it's done under local anesthetic. So that's just a wee bit where you feel a little bit nippy, and after that we'll just go through the whole process of getting a bit of skin removed. Sometimes they may include needing to stitch up the wound, sometimes not. And we'll send that tissue for processing at the lab. And as soon as we get the results, we let the patient know whether anything needs to be done further or not. Yeah.
So then it's case by case what the results are and what the
Right.
treatment is.
Correct.
But you do all of the follow up here at the clinic yourself?
Yes.
Yeah.
After the results are out, depending on what we find, we may recommend certain treatment. Sometimes it may involve no treatment at all, just regular monitoring.
Right.
Sometimes it does involve further surgeries or further procedures. And subsequently, usually we advise patients to come back for follow up to do skin check as well.
Right, so that leads me nicely to my next question. Who is more at risk? What is your advice? Are there certain people, certain ethnicities, certain types of people who perhaps lived in different countries prior to Singapore who are more susceptible to skin cancers or should be checking more?
So in general, the risk factors are patients who are fair skinned,
Right?
who burn easily,
Yes.
put them out in the sun and they become really red fast.
Yes.
Patients who have blonde hair, red hair, blue eyes. Patients who have had a personal history of skin cancers. Because for me that reflects that the patient may have had prior sun damage already, and that just puts them at risk of further risk of any skin cancers. The other things would be patients who have more than 50 moles or funny looking moles, what we
Right.
call it. Yeah, these patients probably should have more regular screening and be more aware
Right.
of the skin.
So would you recommend that they, as well as, self-checking monthly, regularly at home, that they book in for a regular skin check at the clinic as well?
So, in addition to that monthly self
Yes.
check, I usually advise my patients to come annually
Annually,
for
okay.
a skin check. Yeah.
Okay. And what's involved in that skin check? Is it the mole mapping that you mentioned before, or something more?
So, we probably would do the mole mapping as a baseline. So
Right.
the first time when we meet you, we might recommend mole mapping if we think you're suitable for it. These are patients being more at risk of skin cancers, or if you notice any funny looking moles that we want to monitor closer.
Mm-hmm.
And we get the patient to do the mole mapping. It involves, again, it's in a private room, so we probably just one nurse who's behind the computer, so you have a sense of privacy there still.
Right.
It involves this big computer that goes snap, 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 snap.
Yes.
Yeah, and the patient will be standing there in various poses so that we could get a good shot of the body. The doctor have identified, we'll take close-ups of that. Yeah, personally what I do then would be to, if there are any moles that are very suspicious, we get them out ASAP.
Mhm.
But if there are some moles that are a bit borderline, we could still monitor them. I might touch base with the patients a bit earlier, maybe in a couple of months sometimes, to see whether there's been any change. We advise the patients to let us know as well if there's any change. Don't wait for a couple of months, just come back earlier and let us get it out.
Right.
Yeah.
Yeah, so it's important to do an annual check, for sure, to add it into your general kind of health check.
Great.
Is there any kind of particular age that you should start doing that? Is there any more an increased incidence from any particular age, or is it purely dependent on exposure to the sun?
I think there's no guidelines on when you should start mole mapping. But most of the time it's usually adults who do mole mapping. I do use that for little kids sometimes who have a particular mole that I just want to monitor closer.
Yes.
Yeah, just to get a baseline picture of that.
Okay.
Yeah.
That's really useful to know. We've had one question from a member of our audience who is asking about the differences in looking after darker skin tones, because there's a lot of awareness, because obviously, as you said, fairer skin tones are at higher risk. There's a lot of awareness for how to care for those lighter skin colours. But for the member asks for brown skin tone or women of colour, how do we look after our skin? Because most often we don't realise, I'm guilty of this as well, that our skin is tanning because the hyperpigmentation doesn't necessarily come up as burning. So it doesn't react in the same way that light skin does. So is there a particular way that we should be looking after our skin differently? Are we just as much at risk of skin cancers?
I think the bottom line would be there would be no difference in how we all look after our skin. So I would still advise a simple mnemonic. I like mnemonics.
Right.
So simple mnemonic that I like is BCS. B stands for behavior, C for clothing, and C sunscreen.
Right.
So it would still be behavior, meaning you actively try to avoid the sun. You go to a shaded path rather than somewhere exposed. Clothing, meaning you wear clothes that protect you from sun, so maybe sometimes long sleeve, long pants.
Yeah.
Maybe a bit tough in hot Singapore, but yeah, hats,
Yeah.
things to actively protect yourself. And S would be sunscreen. So applying your sunscreen regularly is still a must, regardless of whatever skin color we are. Yeah, because we have seen quite a fair bit of skin cancers as well in patients of color. Though the incidence may not be as high, we still do see them.
Yeah.
Yeah.
So obviously prevention is better than cure, and we'd always strive to prevent any abnormalities from coming. Thank you so much, Dr. Joanne. I think that's been a really interesting overview And hopefully, you know, it's a reminder for everybody to have a regular check at home. It's something that we can all do ourselves. Thank you very much for your help and advice.
Thank you for having me.